Welcome everyone to our first introductory session of Behavior Science Task Forces of Healthcare by Food. We have amazing two speakers today. Both of them are co-chair of Behavior Science Task Force of Healthcare by Food. First of all, we will have Dr. Kevin Bulb for introducing our initiative. And then Dr. Kate Lamberton will introduce our webinar series. Before we start, here is a kind reminder of our disclaimer. Statements, opinions, and study results presented in this presentation may not reflect the policy or science position of the AHA unless otherwise noted. Now I will turn it over to you, Dr. Kevin Bulb.
Thank you, EJ. I'm very appreciative of all of you joining us today. I'm going to talk a little bit about the AHA's Healthcare by Food initiative before handing over to Kate. And I wanted to start by way of background by saying something which is probably familiar to all of you, that food is central to health outcomes. Lots of evidence that this is true in many different organ systems of the body. Despite that, we know that approximately 45% of deaths from cardiovascular disease, stroke, and diabetes are associated with suboptimal diets, and lots of statistics highlight that Americans don't have very healthy diets. Only 1 in 10 Americans meet recommended fruit and vegetable intake. More than 9 in 10 have excess sodium intake. Only about 2% meet whole grains targets, and Americans consume more than 60 pounds of sugar a year. Affordability of healthy food is a significant challenge for many Americans. A recent poll conducted by Deloitte Research America and the American Heart Association showed that 77% of Americans would like to have healthier diets, but that 60% identified as the top barrier to eating a healthier diet the cost of healthy food. More than half indicated that it often happens that children eat cheap, unhealthy food so families can pay the rent, and that seniors have to choose between paying for prescription drugs or paying for food. The US health system hasn't tried systematically to increase healthy food access for high-risk people, and that's largely what our initiative is about. It's about trying to figure out what is effective, what's cost effective in improving healthy food access for people with diet-related conditions. Because a lot of this is about behavior change and meeting people where they are, we've embedded human-centered design as a centerpiece for what we're doing, as well as behavioral science. And there's a lot of behavioral science which is relevant in terms of thinking about the food people consume and ways to change that, which is a big part of why we put together this seminar series. Kate is going to talk in more detail about what specifically the speakers are going to be talking about, but it's really an important foundation for what we're trying to do and what we hope you all can help us try to do better. We also built a lot of rigor into what we do in terms of testing. A lot of the studies we've been supporting are randomized trials. Not all of the studies are randomized trials, but that is, for many of our studies, the preferred approach. We now have 25 studies in the field, with 23 of them being randomized controlled trials in different states. Lots of different partners who are involved in the initiative, both healthcare systems and corporations, and a large number of community-based organizations as well, who I would like to thank for all of their efforts in moving the field together forward. Where we hope you can help and where we appreciate very much your tuning into this seminar series is we're trying collectively to answer questions which can help lay the groundwork for food as medicine programs to be a covered benefit. We're building on a foundation of what's known from WIC, medically tailored meals, and prescriptions and medically tailored groceries to answer the kind of questions insurers need to know the answer to if doctors are going to prescribe programs and insurers are going to cover them. So what is the optimal intensity, duration, and delivery of a program? How do we best engage people initially? How do we change behavior? How do we help people form better habits? What's the role of coaching and other supports? And how do we best test program effectiveness in settings in which it can be scaled? Finally, cost effectiveness is an important element to consider. But all of this really rests on success in changing behavior and figuring out how to do that with high fidelity and at a high rate of efficacy. Finally, I want to thank the many volunteers, grantees, community partners, corporate partners for their role in moving healthcare by food forward and helping us build better evidence in service of the American people. Kate, over to you.
Great, thanks, Kevin. So what I'd like to do is give you a brief overview of the set of webinars that we've put together. Kevin said there are a lot of really interesting behavioral questions that are related to food consumption. The good news is that there are a lot of people that have done research that can support a lot of our decision making as we craft these programs in ways, hopefully, that will allow us to see the most behavior change. As we're doing right now we're overviewing the discussion of healthcare by food and these webinars, but our next webinar will be led by Dr. Justin Sidner at the University of Wisconsin-Madison. And he's going to start right from the beginning of a project design and probably the early stages of our work as we formulate our research questions to help us understand how we could decide between framing something in terms of a program evaluation or a mechanism study. And we'll start with that right in May. After this, we're going to move to the next phase of executing a project, have Elizabeth Linus talk about recruitment and retention. These are huge challenges in any program design, but there is a lot of really interesting research that helps us understand behaviorally how we can do this more successfully. After that, you'll hear from me again, perhaps with a few other people who are going to be involved in what we're calling the behavioral science TIP, the Tactical Insights Program. What we want to do through this program is highlight ways that rapid testing can help us design a better program. There are a lot of small decisions we have to make in any research, ranging from the name of the project to the instructions that we give to participants, that if we don't fully understand, we can throw the project off track altogether and fail to even understand whether the intervention would have worked. So I'll come back and talk a little bit more about a platform that we're going to set up to facilitate those insights. After this, we have a session with two of the world's leaders in branding and in behavior change related to health. Kevin Lane Keller at Dartmouth has written the book quite literally multiple times on branding. What he'll tell you is that a brand is a promise. If we get our brand right, we actually add a lot of value to the service that we provide. And he'll be hosted by Poonam Keller, who has done a lot of groundbreaking research in behavior change related to health. And the two together will be able to provide some really interesting insights about the way that our knowledge of branding can inform effective program design and communication. In September, we'll hear from Pierre Chandon and Julio Sevilla. Julio is a task force member who has also done a great deal of work in areas like self-control and the choice of indulgence over more restraint-based options. Pierre is one of the world's leaders in understanding the way that people make food-related decisions in general and how incidental factors in the food environment can affect people's choices. If we account for these things, we'll probably have a better chance of setting up a food-related intervention or support system that actually works for people. As we move into the fall, we'll have a webinar with Peggy Liu and Kelly Hawes. Peggy is at the University of Pittsburgh, Kelly's at Vanderbilt. Both are incredibly well-published, prolific scholars in the area of food consumption. And they will share with us some insights from their work, specifically considering different factors that we might not think of that might change the way that people respond to a given cue. For example, they might talk about social influences on food consumption. Even if we deliver someone's ideal produce box to them, if they then have to make decisions for an entire family or consume with someone else, their response to that assortment may be very different than we expect. They'll also likely talk about some of the lay theories that people have about food that will affect their propensity to accept or reject anything that's offered to them. After that, we'll step into our world of industry experts. We're fortunate on the Behavioral Science Task Force to have some people as participants who have been real leaders in understanding behavior change in the marketplace. And our first will be Sean Dennis. Sean Dennis formerly was at DreamWorks, American Girl Doll, the NFL, and MasterCard, among other companies. And she has done a lot of work to understand how the stories that people tell change their experience. And so she's going to give us a really creative, different perspective on how we might frame food-related behavior change in a way that make sense for the people who are changing their behavior. After that, Christian Saclier will talk with us. Christian is a creative design and innovation leader for over about 25 years. He's worked across a range of industries, including both pharmacy and food and beverages, most specifically to this project. So right now he is at PepsiCo. Previous to this, he was at Nestle. And so he's going to share with us some ideas about the way that we might incorporate technology and specifically AI in designing behavior change programs related to food. I think that will be a session that will be of wide interest to any of us that are trying to design behavior change interventions right now. After this, we move into next year, and Marissa King will talk with us about network and peer effects and health behaviors. So we understand that food is one of the most social experiences that people have. If we only consider a person's decision-making in isolation, we're likely to miss huge pieces of the story. This, of course, holds for many decisions that people make. So again, I think this webinar will have wide applicability. And then we're going to start moving into the phase of the projects where we hope we have seen some behavior change. If behavior change only happens once or only a few times, all that effort can feel as though it didn't yield the payoff that it could have. And one of the problems in the food domain specifically is that people become satiated. So what they like one week, they're tired of the next. And the next week after that, it no longer has any of the novelty that it did to start. So Professor Joe Redden at Minnesota is going to share with us his insights about how we can combat satiation such that the behavior changes that we've been able to cue are more persistent over time. And then finally, Kevin is going to give us an overview of ways we can take that behavior change into the future. All of our projects, all of our research hopes to create a short-term impact, but we know that the real power in what we're doing is when it creates a long-term effect, such that people's entire lifestyles can be changed and healthy outcomes can persist over time. So we'll close our webinar series there. And again, we'll begin very soon with this upcoming seminar with Justin. If you would like to sign up for that, there's a QR code right here. But EJ is now going to close us up by giving you a little bit more information about how you can sign up and how you can stay informed about all of these webinars.
Thank you, Kate. Yes, we are going to, you definitely can see the RSVP on our email, and you can see many promotion on our website, social media, and always recordings of all of the session will be featured in our website. And thank you so much for joining us today, and look forward to seeing you in the next session.